Great. Am I able to start, Mike?
Yes, feel free.
So, colleagues in the media, thank you for allowing Nicole and I to speak today and share a few comments. I'd like to share I'd like to share a few remarks about pregnancy and breastfeeding and vaccination. COVID-19 has a significant adverse consequence to pregnant mothers and to the newborn infant. So if a pregnant woman gets COVID, she's more likely to be admitted to the hospital, more likely to be admitted to the intensive care unit, more likely to suffer adverse consequences, including high blood pressure, cesarean section, requiring a cesarean section for delivery. So there are significant consequences for a pregnant mother getting COVID. There's also consequences to the baby. There's an increased likelihood of stillbirth, premature birth, low birth weight, and for the baby, if born sick and therefore having to go to the neonatal intensive care unit. So getting vaccinated is a way to reduce the risk of these adverse consequences. And vaccination, in fact, is safe for mothers, and it has there's no evidence of any adverse consequences to the developing baby. The vaccination rate overall in this province is low for pregnant women. The numbers I received estimated at around 60%. In Windsor-Essex, it's even lower than that. I think the number I most recently received was 50% for pregnant women. And we're happy to give you the exact numbers if you want to quote it. But the vaccination rate for pregnant women is low. And it's an area of opportunity to improve the health of women and of newborns, and that's a big priority of the public health service. The next point and the next message I'd like to share is that women who are breastfeeding can get vaccinated. There's no adverse consequence. There's no evidence of any adverse consequence to the mother or to the baby by getting vaccinated if you're currently breastfeeding. And breastfeeding is best, and being vaccinated is something that a breastfeeding mother can do in addition to improve her health and the health of the baby. There is a belief in medicine that the antibodies related to vaccine travel from the mother to the baby. And to that extent, getting vaccinated may provide additional benefit to the baby or the newborn. So there are many, many good reasons why pregnant women and breastfeeding women and those women who are contemplating pregnancy should get vaccinated. The goal ultimately is to reduce the number of people being admitted to the hospital, the number of people getting sick, and the number of people who could suffer very serious adverse consequences from COVID-19. So with that, we're happy to answer any questions on this item. I don't know, Nicole, if you want to supplement my comments or have any other remarks.
I think we can go to questions.
Okay. We'll start with Blackburn today.
Yes, I wanted to ask you, I guess, why are you making this message now? We've been hearing for some time now that mothers are, pregnant mothers, sorry, that's just my alarm, that pregnant mothers should get the vaccine. Why are you bringing this up now?
Well, first of all, it's an important public health message, and so I think that's a worthwhile thing to share today. The province has a blitz, a media campaign this week to try to get that message out, and I think other medical officers of health are going to speak on this topic as well. If I could speak more generally, though, the public health service has a number of priorities, and COVID clearly at this point in time is one of the priorities. But the health of mothers and newborn children is a very significant public health priority, and investing in children in all levels, just not in their physiological health, but in their psychological health and in their schooling, and providing them supportive and nurturing environment are a really important public health priority. So to the extent that we have opportunities to speak about the health of mothers and the health of children and ultimately the health of families, we're happy to do it.
Also, and maybe this is a question for Nicole. I'm wondering, was the Vollmer listed as an outbreak in error, or what happened there?
Yeah, thanks for that question. Yes, so on our website, the Vollmer was listed in outbreak, and it was an error. The institution, the Vollmer Center itself, is not an outbreak, and there is an outbreak of, an exposure associated with a user group. So we issued a correction to that effect yesterday, and yeah, so and I believe the Vollmer, those who are in leadership of the Vollmer would also be responding to questions as well and providing the correct information for users. But the facility is not an outbreak.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Doctor, just from what I've seen anecdotally, pregnant women, one concern is that getting vaccinated could result in a miscarriage. So what's the reality here? Can you reiterate more the safety of the vaccine?
Yeah, the vaccine is not associated with anything adverse to the newborn. There's no evidence that getting vaccinated affects outcomes such as miscarriages. I'm comfortable, and so are I think physicians overall, with recommending vaccination because the risk benefit favors vaccination at this time.
Are you aware?
And just to supplement that, there are no ingredients in the vaccine that are adverse to the pregnancy itself. So I think people can be reassured that they should get vaccinated if they are pregnant.
And are you aware of any pregnant women in this region who have contracted COVID and have experienced negative outcomes?
Well, as a general construct, our job is to try to protect the privacy of patients and privacy of the people we serve. So I'm not really able to comment on that specifically. We know that the pregnant women have had adverse outcomes from COVID, but I'm not able to comment specifically on any individual case in the health district.
Thank you.
Any questions from AM 800?
Nicole, I know we touched on this briefly on Monday, but yesterday afternoon the release came out for Halloween. Just looking at it and reading it, very similar recommendations to last year.
Yep, that's correct. Pretty similar to last year, other than I think certainly if you're planning any kind of small gathering, vaccination status, knowing vaccination status of those that are attending is an important part of protecting yourself and individuals at that gathering. But yeah, our recommendations are pretty similar to last year.
I know there's a long list here, but just overall, your message to the public this Halloween. I know it states right at the end: follow all public health safety measures, make sure maintain the distance. Obviously, this is key here. If everyone follows this, similar to Thanksgiving, I think, because I don't think our numbers really spiked during the Thanksgiving weekend. Seems like everyone did their part. So you're hoping the same thing happens here on Halloween.
Yep, Dr. Messeri, do you want to start?
Yeah, we're hopeful that people will follow public health guidance as it relates to Halloween, which includes trick-or-treating from a distance, wearing a mask, avoiding large groups of people, staying in your neighborhood, all the things that minimize human-to-human interaction and minimize the transmission of COVID, I think would be helpful. The one thing to think about is that many of the young people going trick-or-treating are unvaccinated. So that has an additional risk. We know that vaccinated people have a lower risk of getting COVID, a lower risk of transmitting COVID to other people, a lower risk of being hospitalized, and a lower risk of dying. Now, in this particular case, most of the children, not all, but most of the young people going trick-or-treating are going to be are ineligible for vaccine. And to that extent, that we should just be vigilant in trying to minimize the spread of COVID related to Halloween events. We've dismissed, and perhaps a better way to characterize this is about more than 300 groups of young people have been excluded from schools because of COVID-related exposures. So we are very concerned about Halloween-related exposures, and we hope that people will, and the community will heed the public health measures and the guidance so that we can minimize the risk of transmission.
I'll just add that probably one of the most important pieces as well is, and as always, is making sure that you screen. So for parents, making sure they screen their children and not participating in trick-or-treating or any kind of a social gathering related to Halloween if their child or themselves are sick, and stay home and consider other ways, to celebrate Halloween, whether it's, hiding candy around the house and doing a trick-or-treat inside, but just, really making sure that individuals who are ill or not are staying home or, and getting tested as appropriate.
I know you're talking about the trick-or-treaters, but I guess for the adults that might have parties or go to a restaurant or a bar, similar message to them, or what would you like to share with them?
Do you want to go ahead, Dr. Necessary?
Yeah, it is a similar message. COVID is primarily transmitted by respiratory particles from one person to another when they're close by to each other. And that is reduced when someone wears a mask indoors and is vaccinated and maintains social distancing. Gatherings are always a risk, and large gatherings are a greater risk. And so we would encourage adults also to follow the public health guidance that we recommend for other events as well. If I could just share, I think everyone recognizes that COVID-19 and the public health measures are inconvenient and are disruptive. And as it relates to young people, no parent wants to say no to their kids. That's it's an entirely human. As a parent, I know that it's entirely human to want to make sure your kids have the very best childhood they can. And but in this particular case, we're not out of the woods as it relates to the pandemic. I think we're doing better for sure, but we're not out of the woods. I think we have to continue with public health measures. We have to hope that vaccination for young people, for children, becomes available, hopefully as soon as possible, and effectuate the vaccination program so that we can have better control. Once we get to a point, I think that when we have more widespread and higher vaccination rates, that might give us an opportunity to withdraw or modify some of the more restrictive public health measures. So sorry for being long-winded on that, but the Public Health Service is concerned about many of the same things that every other member of the community is concerned about.
I'll just add before we move on, operationally for the, as you said, for adults, if they're having, especially small or private gatherings, really important, again, to make sure that if you're ill, you're not participating. And for those who are, hosting a gathering, if they choose to do so, being mindful of the risk and making sure that they keep a good list of the individuals that are there. That is important for us when, if there is an exposure, for us to reach out and complete, do our jobs related to contact tracing. So, and I know those are all, that information is all part of our recommendations as well.
Thank you.
Any questions from CTV?
Yes, good morning. Do you think some of the advice, the recommendations for Halloween will be hard to follow for children, such as no shouting or limiting houses? Maybe a bit of a tall ask for some kids, and I guess you're relying on their parents, like you mentioned.
Yeah, go ahead, Nicole, and I'll follow you.
No, go ahead.
Well, I think that public health measures are not always easy to effectuate. Being a parent is not always easy. I think we all know that. And trying to get your young people to follow the guidance, especially on a holiday or in some celebratory event, is difficult. That being said, parents do this all the time. They shape the conduct and the behavior of their young children, and I would suggest that we have to do the very best that we can, recognizing that it is difficult. It's difficult not only for managing COVID, but it's difficult for being a parent overall. And this is just one additional challenge that parents have, putting forth these recommendations. I recognize that incorporating a mask in a Halloween outfit for a 4-year-old can be a real challenge, for sure. On the other hand, no one wants their 4-year-old to get sick. So that's the balancing act, and I think that most parents will do their very best to effectuate the public health plan.
Okay, thank you. And are you planning any special initiatives to get the message out, or are you mainly directing people to the website and through media channels?
Yeah, so through the media, we hope to get the message out as well. We'll have messaging on social media. We also have, we also work with all of our school boards and schools through our school health team and our school health nurses to share information, especially as it relates to children and youth. And, prior to the pandemic and during the pandemic, Halloween safety has always been a public health message and something that we have focused on. And so, we'll continue to work with all of the channels that we normally would as it relates to sharing information with parents.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I recently looked at the provincial data on deaths, and the rate of COVID-19 fatalities here in Windsor-Essex throughout the pandemic, it remains one of the highest in Ontario out of all the public health units. I appreciate this is a big question, but Dr. Nesbitt, what do you think some of the factors are that have, driven this trend throughout the pandemic and led us to have such a heavy burden of deaths in particular?
Well, I don't have the epidemiologist here with us, and we can, when he returns from holidays, perhaps we can ask him to drill down on that data. But I think a few general observations. One is that death is likely, as a clinical outcome, is likely a function of the number of people who are infected. And so Windsor-Essex has had a disproportionate number of people infected, and therefore you would expect that you would have a disproportionate number of deaths. Secondly, the risk of dying is proportional or is in some way correlated, likely, with the distribution of the age. And so I would hazard to say, or I would infer that to the extent that the distribution of age may be disproportionate in some districts more than others, but that probably also affects the likelihood of people dying. Now, this is a more generic construct, and I think it needs some more validation. But in general, getting sick and having poor adverse outcomes is related to socioeconomic status and the relative affluence or lack of affluence of a community. And we can ask the epidemiologist to perhaps comment on this further, but that's, I think, something worth exploring is a component of the disproportionate number of deaths related to the economic and social status of the community. So those are sort of some general comments. We would have to investigate them a bit further. And if you were to send us an email, perhaps we could comment on that more formally, if that would be helpful.
I would just supplement as well, and Windsor-Essex, we do know that COVID-19 age is one factor, but also other chronic conditions is another as it relates to poorer, more severe outcomes. And we do know in Windsor-Essex, we do have a higher burden of chronic disease compared to the province. And in particular, when we look at all cancers, cardiovascular disease. So again, great questions for our epidemiology team, but we do know we do have a higher burden here in Windsor-Essex as it relates to some of those outcomes that would, that would play into risk, and certainly risk for death as it relates to COVID-19.
Thanks very much.
Any additional questions from Blackburn?
No, I'm good. Thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Okay, thank you, everyone. We'll see you tomorrow at 8:30.
All right. All the best.
Have a good day, everyone.